Now, as you know, every morning we bring in an expert to answer your questions on some of the big issues in the coronavirus crisis. And given what we're covering of late, the impact of this on Canada's vulnerable seniors population, we're going to devote our program today to answering your questions, seniors issues, the whole range. And to answer your questions, we're so pleased to have Laura Tamblyn Watts with us this morning, the president and CEO of CanAge, which is a national seniors advocacy organization. And you're not hearing me wrong. We're coming to you from Whistler, BC, where it is 3:21. And you are a good sport, Laura, for doing this, for you're pulling an all-nighter for us today, and I really appreciate it.
Good morning.
Good morning. Listen, that just reflects the seriousness of the issue to you and to us and to people who are writing us with questions already. Can you capture for me, Laura, what it's like in your office, what it's like on your phones right now at this time of the coronavirus crisis?
In more than 20 years, we've never seen anything like it. Our phones are ringing off the hook 24/7. Everyone in the seniors community is really pulling together collaboratively to deal with this crisis.
So when they're ringing off the hook, what is on the other end? What are the questions and what are the concerns that you are hearing from Canada's seniors?
Part of it, of course, and we're talking about long-term care, is, what are we doing in terms of getting the personal protective equipment and the testing into long-term care? And I can tell you, not enough. People are very worried about elder abuse. We've seen a spike of about 10 times in the last 10 days. So physical abuse, financial abuse. We're also looking at people who are very worried about their retirement. Maybe they're in retirement or pre-retirement, and their savings are disappearing. It's the whole spectrum.
So we're definitely getting many questions about what to do about finances and pensions and portfolios. But come back to that elder abuse story, if you would, for just a moment. 10 times an increase you've noticed in reports in the last 10 days. Is that from elder abuse is often, as I remember it, from family members or from people that they know or caregivers? Does that reflect the strain of the moment, or what are you attributing that to? That's a stunning number.
It is a stunning number. We know about 1 in 5 Canadian seniors will be subject to elder abuse, and the area is very underfunded in terms of response, but we've never seen anything like this before. So people are locked in their homes, often in a very high-pressure circumstance, and often where we have generations who may be worried about their own financial well-being. And we know the bank of mom and dad is often there. So we're seeing people who are having powers of attorney forced upon them or forced withdrawals. We're seeing people being threatened by family members. But at the same time, we're seeing a huge spike in frauds and scams specifically targeted to seniors, specifically about COVID-19. In fact, we're releasing fact sheets almost every day on new COVID frauds and scams.
We have been covering some of those, but we'll obviously have to look into this further and to this part of the story. So, Laura, we will doubtless, with our CBC News colleagues, talk more about this. I'm interested in jumping right to a question from Steve Steen for you, Laura, and this has to do with long-term care facilities. We've been talking about that, the recommendation that anyone who can remove a senior from a facility and bring that person home to be cared for by family. Steve Steen is wondering about that. Many seniors are being removed. What is the government going to do for the caregivers at home regarding this? Now, we don't know that. I guess we've had a promise of something from the federal government that there will be more assistance as far as seniors. But just on the point of taking a senior out of a long-term care facility, if possible, can you shed some guidance on where you stand on that?
It's an enormously complicated question, and it does depend on the individual. Certainly, we're seeing COVID-19 ripping through long-term care homes. And I would say we're just at actually the beginning of the wave. So for people who are thinking that they may be able to provide the support at home, certainly it's something many folks are considering. Having said that, and we've released at CanAge a number of fact sheets to help people think things through. Typically, people who are in long-term care have such a degree of frailty and a degree of need that they cannot easily be taken care of at home. You need special types of medical equipment, special knowledge, special hospital beds, and so on. And so really helping people think through whether or not it is a good idea for them is something that we're doing every day on the phone 24/7.
Speaking of, the question was specifically about what government help is coming, and as I mentioned, there has been a promise from the Prime Minister just as recently as yesterday that there will be more coming for seniors. What are you expecting, and what would be the greatest help from federal government for seniors right now?
Right now, it would be to actually commit with the provinces and territories to get the personal protective equipment into long-term care. There has been a priority to put them into acute care settings. We're seeing that people who are providing hands-on care, so bathing and toileting and feeding, are not getting personal protective equipment, and it's dangerous for them. And it's dangerous for residents. So if there can be one thing that they can do is to get the PPE into long-term care homes and do it yesterday.
Getting workers in, getting PPE in, is this the only thing that we can do at this point, or that officials can do to try to stop the spread?
We need to make sure that we are, wherever possible, at least cohorting. And that means people who are sick, at least in the same area together, people who are well in another area together. That can be a challenge because our long-term care homes are very full as it is right now. But there are techniques we can do to make sure that we try to keep those who are well apart from those who are sick.
A couple of questions coming in from viewers, and they're good ones for you. I think, Laura, Cheryl writing in from Ontario. We've been talking about the recommendation to, if possible, take your loved one out of a long-term care facility. And Cheryl would like some details on that, because does it jeopardize their spot in the home to possibly return? Do they lose the doctor? Do they have perhaps limited access to their medication? So concerns about the policies in place for anybody who makes the decision to remove a relative from a long-term care facility.
And these are the right questions to be asking. We, at this point, don't have any real government assistance that would be able to help you afford to actually do that and to buy the equipment that you would need. And you need to make sure that you are actually able to take care of the person, particularly since about 80 to 90% of the people in long-term care have some type of dementia or cognitive impairment. Will they lose their space? It depends on what province you're in. Ontario has announced on about the 24th of March some new provisions for flexibility in that, but there's no guarantee that that same spot will be there. You'll be on a crisis list, so you'll be at the top of the list, but we know that crisis lists can be months. So if you do take your loved one out of long-term care, it may not be seamless to put them back afterwards.
You mentioned dementia, Laura, and we have a question from Linnell to that effect, not a relative in a facility, but in fact her husband who has dementia. And he goes out for walks every day, able to do that, picks up books, she tells me, from front yard libraries and then goes to convenience stores. How dangerous is that?
We're really worried about people, particularly people with dementia who are engaged in walking or wandering. It's very hard, particularly if you're trying to make sure that they're washing their hands, they're not touching their faces, and they're engaged in social distancing, to make sure that they actually are not going out and putting themselves or others in more danger. And so we're seeing people who are providing supports at home taking some extraordinary measures. I've talked to people who are literally barring the doors from the inside to try to keep their loved ones safe. It's a real risk, and it's one we're worried about.
Here's another concern. Obviously, the health risks of COVID-19 to a frail elderly person, but it's not just the health component. The isolation can be so dangerous, and we're hearing from Julian wondering about this, and this is his wording exactly, and it raises just major alarm bells for me. Has the Ontario health system, and this would be one that we considered nationally, but has the Ontario health system considered suicides, particularly lonely seniors, may increase as a result of prolonged isolation? I am one of these people. You know, this cry for help from so many people we're hearing at this time. But I wonder what, for people who are feeling isolated, having dark thoughts, Laura, where do they turn? And what should people who love them do and watch for to avoid these worst case scenarios?
It's enormously difficult. We know that mental health is really suffering at this time, and we know that older people do suffer depression more than other populations generally in this country. So together, it's a real issue. We do recommend across this country that if you are needing help and assistance, you can call 211 on the phone, and they will route you to whatever best services are available to you. But we know that social isolation is as dangerous for older people as smoking about 15 cigarettes a day. And so what we are trying to make sure is that while we keep people physically distant, we don't keep them emotionally or socially distant. That's especially difficult, though, for seniors who live alone. So we're trying to make sure that we're having connections to the community. We're being creative in having porch parties and other types of engagement. But it's a real concern. If you are feeling unwell or you're worried about somebody who is feeling unwell, you can call 211 across this country.
211. Okay, that's good to remember. We've heard some really wonderful programs like Adopt a Grandparent, a stranger in a long-term care facility. That was a program I heard about. Nova Scotia said it was going to purchase 800 iPads for seniors so they can stay in touch with their family members. So key initiatives underway because the need is obviously tremendous. Laura, can I ask you, I mean, I think it's a time that people are saying in this country for difficult conversations within families, given the fact that this is spreading through so many parts of our population and everywhere in the country. And anecdotally, I've been hearing, and we've been hearing about people going to lawyers, seniors going to lawyers to get their wills in order, make sure their families are looked after and there are no issues. I'm just wondering what you would suggest as far as I said, those are difficult conversations. Last rites, last wishes, wills. What are you suggesting to people?
They are extremely difficult. But it's really important to have those conversations, particularly because we needed to know if you want certain types of care. And when we say that, it is important to get a perspective. If you have a 95-year-old with congestive heart failure or a 92-year-old who has trouble with COPD, a ventilator is not really going to be an option for that person. So if they're mentally capable of giving their wishes to you, it's time to have some of those real conversations. It's also important to know that the law societies are looking at being able to execute documents in a virtual way, which we've never been able to do before. So Ontario has led the way, announcing yesterday that it would allow a virtual signing of wills. And we're going to see that, I hope, the rest of the law societies soon are moving to allow family members to get their personal plans in order at an important time.
So the questions that I know have been coming into your organization are as, essential, are as vital as those, difficult as those, but also they range into the practical finances. And we have a question from a viewer, Claire, Laura, wondering about food, saying that some of her single friends who are seniors have been trying to order food online, but there is a big backlog. And her suggestion was that seniors should be given priority as they are, I guess, in the shopping, that many of the stores are open for that extra hour early, so it's just for seniors. But in terms of delivery, her suggestion is that seniors be given priority. That's not the case right now, but I'm wondering what you would suggest for seniors who are having difficulty accessing their normal meal services.
It's quite common to see 2 and 3 week waits for deliveries of groceries. I was speaking with a couple in their 80s yesterday, and they tried to go online and have delivery done, and it was going to be sort of at the end of April before there was a slot available to them. This is an opportunity to use resources in Ontario. The Ontario Caregiving Organization is working to connect people. The United Way is looking to connect people. So there are ways that you can get community-based resources, but what we're seeing is really an outpouring of caring from Canadians to older adults who they know are perhaps isolated or needing some support with things like groceries. It's neighbor to neighbor saying, do you need help? Or leaving groceries on the doorstep in a socially distanced way. So there are organizations, but also community in action.
Laura, thank you very much. I really appreciate all of your time and expertise this morning. Very, very helpful. And we'll keep in touch because there are more questions to come, certainly, as this issue continues to confront our country and the seniors in it. So thanks, Laura, very much. Laura Tamblyn Watts